I took a different tack in preparing my interesting case. I only have one case for you, but I thought that because I gave you such a broad perspective on how to treat patients, that I'm actually going to show you what can't get written in the guidelines, what really requires you knowing what you're doing and kind of addressing things as they come up. I want audience interaction. I'm not going to have any multiple choice questions because these are not easy to write. And by the way, one of my disclaimers that I failed to put on my slides is I actually write questions for the ABIM for the hepatology program only, so you won't see my questions. I don't think there's any of you taking the transplant hepatology section, but I do know what it takes to write a good question, and I think it's difficult to do some of these. So my case is that of a 64-year-old man. This is a real patient. A dear friend of mine, actually, become friends over the years trying to handle these problems. 64 years old with a history of Hep C, referred for tertiary care. He came to us from UCSF, actually. The patient was exposed to hepatitis C in the 1970s when he was using heroin IV. He resolved this habit and went on to be diagnosed with hepatitis C in 1990. Notice that this is happening in many of our patients, many of the patients I see, and you may see some of these. They've known about their Hep C for many moons. They just haven't kept up with the medical literature to know that there's actually really good therapy now, and they leave with the nightmares of their friends who suffered through interferon, which was really difficult for many patients, particularly those with advanced liver disease who may have been their contemporaries. So they didn't choose to even reveal that to their doctors, or if their doctors talked about treatment, they said, don't want to do it. And we knew him to be HIV negative, infected with genotype viral 3A, and had prior exposure to hepatitis B with detectable hepatitis B surface antibodies. He was then treated with interferon and ribavirin in 1999, so it took him almost a decade to decide to be treated, after which he relapsed. He tolerated the regimen very poorly, had significant depression, which was something that we saw very frequently with interferon, and he hated ribavirin. I mean, he absolutely detested the anemia that it caused. He then went on to experience his first episode of hepatic decompensation as a variceal bleed in 2012. He, however, despite the fact that his disease continued to progress, refused to be treated again until 2014. And mind you, by 2012, we already had the first generation of direct antiviral agents, which still unfortunately required interferon, so that's the reason he didn't really want to do this. And he was then given a therapy when he arrived in Arizona with sofosbuvir and ribavirin. He